Hi everyone, my name is Yael Steuerman, and I'm really excited to be here to share with you one of my passions, which is using the power of computer science to solve biomedical questions. So I've been in this field for quite some time now. I did my PhD in computational biology, researching our immune system. And about a year ago, I've joined KeHealth as an algorithm developer. Today, I'm going to talk about how we can use patient-specific data to predict future events. So let's talk about your health. Each and every one of us are interacting with the healthcare system. It can be when you had your blood drawn, or you went to your family physician and he diagnosed you with upper respiratory infection. So there are different kinds of interactions: symptom, diagnosis, labs, prescriptions, and procedure. And the ensemble of all of these interactions are creating our medical record. So if we look at our medical record over time, we can see that there are many visits, and each visit may contain one or more interaction. So the question is, can we utilize this patient-specific data to predict a future event? And moreover, can we actually use a population, medical record from a population, to devise a better health policy? For example, do an early screening for a specific subpopulation. So the answer is yes, we can. All we need is a large cohort of data. And at KeHealth, we have data from our users, which interact with us. And we also have a partnership with Maccabi Healthcare System. So all in all, we have over 2.2 million patients and the full medical records over 20 years, which is also anonymized and de-identified. And it's also considered a rich coverage because we have information from visits to our family physicians, but also from visits to alternative medicine. Okay, so our goal was to predict disease risk, both at the patient level and the population level. So we were specifically interested in ischemic heart disease, which is characterized by a reduction of blood flow to the heart muscle due to a blockage of the arteries. And we were specifically interested in this disease because it's highly prevalent. It affects over 110 million people per year. And it also has a high risk mortality rate, over 50% of all deaths per year. It's very interesting in diagnostic-wise because it can be asymptomatic, meaning that some of the patients don't have any symptoms before the heart attack actually occurs. So what can we do about it? How can we actually help? So let's imagine the following scenario. Dana is going for a routine checkup at her family physician. He measures her blood pressure and he sees that it's elevated. Her medical record is being updated on our server, and our predictive model now assesses that she has a high risk for ischemic heart disease. And so, she gets the following alert from our app. Hey Dana, we've noticed your blood pressure was elevated recently. How do you feel? When she taps this alert, a dialogue opens, and we encourage her to talk to one of our doctors. When she presses "Tell me more," we're saying that based on her medical record and risk factor, we've estimated that she's now at risk for ischemic heart disease. So for now, this is a dream, but it can be our reality. We want to be able not to only say that she is at risk for ischemic heart disease, but also say why she is at risk. So we wanted to build a model, but not just any model. We wanted a super model that will also have high performance and will be valid, and will also offer explainability to explore and assist clinicians to better understand the population, and also investigate patient-specific medical history, and of course, provide new medical insights. So how can we do it? So RNN is a method for sequential data, and so it's very popular to model medical records. First, because of the temporal nature. Using RNN, we have the knowledge of a certain patient in time t, includes actually all his prior visits. And also because of the patient representation. we can take each of these visits and provide them as a feature vector as input for the RNN. But the naive RNN also have limitations. It is considered a black box, which means we do not necessarily know where a certain prediction was being made. And because the problem of irregular sampling, RNN assumes a sequence, and here the time between two visits may vary. So we're going to focus specifically on these two limitations in our solution. Okay. So first, we're going to learn the importance of each medical record in each visit via attention mechanism, and then each visit will be calculated as a weighted sum of its record. To account for the irregular sampling problem, we're going to attach the difference in time to each visit. Then, to mimic how a doctor actually reviews the medical record, also backward and forward, we're going to use a BiLSTM. And then we're going to learn another attention mechanism, but now on the visits. So we're going to learn the importance of each visit, and the final patient representation will be calculated as a weighted sum of its visits. Then, from the patient representation, we're going to assess the risk for each of these patients. Okay. So going back to our requirements, we want a model that will have high performance, and we're not going to talk much about it, but we compare different models, and you can see that our model has the highest AUC, which means we didn't need to sacrifice the explainability for high performance. So let's go back to explainability. Just to remind you, we wanted also to be able to explore and assist clinicians to better understand the population of interest and investigate patient-specific medical history. So we devised the following research and decision support workflow. First, we use the patient representation to get a patient overview of our cohort, and then we'll be able to choose a specific subpopulation of interest and get statistics on it. For example, how the age and gender varies on this subpopulation. If we see this subpopulation is interesting to us, we can also add to that model statistics. And by that I mean which one of the medical records were important for assessing a specific risk score. From that, we can get population insights and also build a new policy based on that. If we're interested to look at a specific patient, we can follow his medical history highlights and from that gain individual insight to try to prevent a future event. So we're going to focus specifically on a single patient scenario. So here we can see a patient-specific medical history highlight. Meet Clark. At the first visit in which he had a risk score over 0.5%, our model highlighted that the specific record in this visit that was important was erectile dysfunction. And erectile dysfunction can be caused by a problem in the small arteries. If we look back, we can see that in one of his first records, essential hypertension was observed, and essential hypertension is a known risk factor for ischemic heart disease. So over time, we can see that his risk was elevated due to more records. Some of them are a known risk factor for ischemic heart disease, but some are more subtle and still highly predictive. So it's important to note that this accumulation of risk can be hopefully stopped by early intervention. And we can test this early intervention beforehand using the what-if effect. So here, you can see an example for what-if effect, which means that had this person not have erectile dysfunction, his risk will be substantially lower. So this is a good example for how a specific record actually affects our overall assessments of risk. So just before I summarize, I wanted to tell that I'm very thrilled to work on this project because I believe it can really empower our users. By that I mean you, with actionable items that is helpful for their own health. So to summarize, I've shown you that medical records can be utilized to predict risk scores. classic RNN are highly accurate, but they lack interpretability. And here, we specifically focus to add a two-level attention that will improve accuracy and explainability, both at the visit level and also on the medical record level, to see which one were important in each specific visit. Then I showed you how the exploration of both population and patient-specific medical record can help us in develop new policies, preventive medicine, and new medical insights. Thank you very much.